we always think, we're trained to take care of our patients. We're trained to think of others first before ourselves. But by doing that, sometimes it's we ignore ourselves. We don't like, I would go on a whole clinic day and not go to the bathroom until 3 o'clock. I have done that a few times.
Yep.
That's not good. Like when people ask, "Oh, who are you?"
Mhm.
A lot of times we hear that, "Oh, I'm a doctor, I'm a mom." Yes, all those things are true, but who are you actually being? Like for me, is I am the person who wants to help other people. I am a person who is thankful all the time, and I'm the person who wants to serve others, who want them to feel better and have more control of their lives, and just and with that ripple effect to make the world a better place.
I like want to cry through all of these messages. Uh, Very dear to my heart. I think those are all extraordinary messages. And people that know my story know that suicidal ideation was a very strong part in this channel. Is everything that you are everything, right? Like, thanks for tuning in today. I had such a wonderful discussion with Dr. Mary Leung. She is everything that this channel is about. If you're enjoying the channel content, make sure to subscribe and share with anyone else who you feel would benefit. We really enjoy having you as part of the community, and we're so glad you're here. I hope you enjoy the discussion. Hello, everyone. Welcome back to the channel. I am so excited to bring to you Dr. Mary Leung. She is a hematology oncology physician and a physician coach. She's going to share with us her story, and including her story and journey with burnout, what things have been helpful for her, and how she is helping other people to be able to manage and prevent signs of burnout for themselves and to live more fulfilling lives. So, Mary, thank you so much for joining me on the channel today.
Well, thank you, Jillian, for having me today.
Yeah, and for the audience, can you share about your story and kind of before you're a physician? I'd love to hear more of that, personal background, and then we'll dive into life as a physician and then what you experience with burnout and how you've been managing it.
Sure. So I grew up in Hong Kong, and my parents are both physicians. They're retired. And when I was growing up, my parents would, during dinner time, talk about their patients. They work in different practices, and they would ask each other their opinions of what to do with this patient, that patient. I mean, it was all confidential, so I don't know who the patients were, but it was just very interesting how they really found joy in discussing the patients, and really really experienced that they love to help the patients. So naturally for me, that, oh, becoming a doctor is like the best thing to do to help people. And my parents never forced me into medicine. In fact, my other siblings are not in medicine, and so it was just became pretty straightforward path for me to go through. Just throughout elementary school, high school, and then my parents sent me to boarding school, to the United States in 12th grade, and then onwards I've been in this country since then, and just going through undergraduate, and then to medical school. It was just okay, kind of like going through one step after another. It's kind of set path. Okay, next step is you get into medical school, and then you go through the pretty intense training, and then the next step would be to go through a residency program. So I went through all those. It wasn't easy, and but then I thought that, okay, the next step would be better. Then I would have accomplished something. And then came residency. So I got into the residency, internal medicine residency of my choice, more because of my then fiance, now husband.
Mhm.
That's where he was living, and so I chose on Long Island, and everything was going fine, but it was also I kind of just going through the motions, that okay, I have to do this, I have to do that. And then came fellowship again. I chose to stay in my program in residency, the same institution. So I got to do that, which was really nice. So then, years gone by, I was like, okay, finally, I am attending. So, things is like really good, right? Just getting to the top of the world in a
Yeah, and
sense.
I'm hearing the laughter too, right? Because we talk about, I think we hear this a lot in the coaching world, but like people that haven't heard about it, there's that name for it, right? The arrival fallacy that we just experienced. And I can tell from your expressions, you're like, yeah, right? Like, you know what I'm talking
Exactly.
about. And at the top of the mountain, when we were at the ACE conference together, someone said, yeah, and
Hmm.
at the top of the mountain, there's a prison. And they're like, that might be, it's a visual that we can relate to. But I just wanted to pause and appreciate that how many people have felt that.
Hmm.
And I'm going to put my head down because we'll be happy when, or I can breathe when, or I can start living when. And that when you're experiencing that, what does that look like for you?
It's just that when was like you can never reach that when, because when I became an attending, I was like, oh, that was it.
Mhm.
It was just like I was just doing the same thing as I was as a fellow, and a lot more responsibility on
Yeah,
top of that.
yeah,
And then they started me off easy. I joined a private practice, and so I was started as a brand new person, not really replacing anybody at that time. So it was like a new schedule. So they built me up slowly. But soon enough, 3 months later, one of the senior partners retired. So then I started to have more patients. So then my schedule would be filled, with 25 to 35 patients in a day, and benign hematology mixed with oncology patients. So then I was just saying, okay, I have to go through the day and just take care of the patients. I mean, all this time I just wanted to serve. I wanted to help the patients the best way that I could, but it was to the point that I was so stressed and overwhelmed that I thought, how was I supposed to take 15 minutes to take care of all these things in the patient and be on time and write my chart and answer all the phone calls and all these things? And I was just, I was going through the day that what ended up happening was I was sacrificing my charting time. So usually the first part of the day I was kind of okay, able to keep up with the charting. And then the second half of the day, I would start to be falling behind because my belief was that I had to keep the patients be on time to see them as much as possible. So what I sacrificed was then I piled up the unfinished charts to be done at the end of the day. And so that ended up to be, a lot later, and I would go home, past 7 o'clock, and just to see my family, my kids. And after my kids went to bed, I would continue to chart some more.
yeah. And this, just for like people that are in medicine, they get this. But when it comes to being a patient, like when I understood what the internal medicine physician that was my internal medicine physician goes through, like I was like, oh my gosh, after med school, I was like, oh my gosh, I felt so guilty about messaging her because I think until you've been through it to conceptualize the responsibilities and the constraints that are placed upon you, 15 minutes, right? Like what we've been talking for 10 ish, right? For you to have to
Mhm.
do a whole visit during that time. Well, of course, charting is sacrificed, right? And then you have to remember what happened during that conversation with your patient. And if the
Mhm.
patient has other things like other family members in there, I'm just remembering, like, geez, the things that go on, you're like, you just write it down as quickly as you can, and I'll do it later because during that time it's not feasible. And how common it is for that setup to cause people so much distress that, there's charting coaches, there's coaches specifically for charting. And
Yeah.
even with optimization of charting, it just, I, when I was attending, my first thought was shared with you is like, I think I made it. And then like, how do I get back into training? Because the additional responsibility, and it's not just patient care. It's just like, did I do the, I don't have enough people above me to like make sure I recommended the right thing. So I just wanted to say how much I resonated with what you were saying and how many other people must resonate. Like, yes, I can't wait till I'm out of residency. How do I get back into residency? Because it just is like, that additional responsibility comes in so many different forms, and however that person manages it, we'll be able to talk about, because coaching certainly helped me, and I
Mhm.
anticipate that's been a huge component of what's helped your mindset as well.
Yes, for sure. And so, with that, and just back to the charting a little bit. So at the end of the day, I was already tired, and then it would take me actually a lot longer to finish a chart compared to if I finish it right then and there, right after seeing the patient. So that all added up to it. And then, you know, I would go to bed and then just to wake up for another day of, you know, basically the same day all over again. So I was just, years, went by. I was just thinking, why am I doing this? Why is medicine like this? I was just questioning this, questioning that, and I felt like I did not have time to spend with my family. And come weekends, I would sometimes even work on my charts. And I didn't, at one point, I didn't even feel like going out to hang out with my friends because I just felt so tired and I didn't have the energy to interact with other people, even though I loved the human connection. So then, fast forward a little bit, the pandemic hit. So I think that's when a lot of people came to realize that, something, something different needs to happen. And that's also when I discovered from a physician group um, that, hey, there are physicians out there who are doing something else other than clinical medicine or like pharma, that type of thing. So so then that's when I discovered life coaching. I was thinking, what is coaching, outside of sports? I had no clue. And so I got introduced to this, coaching concept as, a coach being a guide to show you, what you have answers already inside of you and how our thinking of our situation affects how we feel. And of course, we all do things according to our emotions, according to our feelings. So what we do affects how we act, and of course our actions determine our results. So I was, the first time I heard about it, I was like, wow, that is so simple, but is so true. And no one taught me this. And I don't think most people, I don't think they know about this. So then I went on, I wanted to learn more. And so I attended a couple of the big group coaching sessions. I did not volunteer, but I learned a lot from other people volunteered and being coached. Then I just decided, something has to change for me because I wanted to feel better. I wanted to just feel even just a tad bit better than I was then. So I made the big leap to join um, physician women physician coaching program that I think we were both in.
Yep.
and
Uh-huh.
and so then that program really just transformed my life. So it was a combination of group coaching and one-on-one coaching. So with that, I was able to, work with the coach and just managing how I was thinking. And I realized that at the second half of the day, I would be thinking that, oh, I was very tired. There were still so many things to do. How was I able to do this? So, because I was thinking that, I was just kind of frustrated. I was, not really focusing on what I was doing. And, with that kind of energy, I just didn't want to do it. And I was slower in doing things. So, that or turned out to be that I wasn't able to finish my charts on time. So by realizing that, then I was able to manage my mind to say that, hey, you know, I am the person, or in the beginning, say, hey, I want to be the person who finished my charts on time. And I think the more important thing is also to say, hey, why do I want to do it?
Yeah.
And the why was I wanted to have a life. I wanted to be able to spend quality time with my family. So, in order to do that, the immediate next thing to do is to finish my charts on time. So, I was just working little bit by little bit in increments of half an hour, just to say, hey, because we are thinking about so many different thoughts throughout the day. Some of them we don't even recognize that we're thinking. So I learned to be more conscious of, what I was thinking and redirect my focus to be finishing up my charts on time and also allowing myself to be a little bit late to see the next patient, but use that extra few minutes to finish the chart, of the previous patient. And by doing that, I was able to give fuller attention to the next patient without thinking about, oh, I had to do this and do that for the previous patients. So within about 3 months, I was able to cut down my charting time by 2 hours a day,
Wow.
which was
Oh my
amazing.
gosh. Yes. And for people who are maybe not, I know there's a lot of people that haven't heard of coaching, and the group for women physicians that is where I started and actually started the trajectory of changing my life is Empowering
Yeah.
Women Physician by Dr. Sunny Smith. So I'm definitely a huge advocate for the work that she does. So if they're just here coaching and they're feeling resistant, or during burnout, you're like, oh, things will never get better, I would certainly invite them to at least start with joining the group if they have Facebook, be around like-minded
Mhm.
people, and then of course we'll tell them later how they can work with you one-on-one. But I at least wanted to pause and give them that resource, because just being part of that Facebook group alone, it started changing my mind, opening my mindset. And then of course having a coach like you that actually, you've been through it, you've been through your own coaching certification, this life experience, will certainly want to offer that one-on-one. But wanted to pause, give her a shout out, give the Facebook group a shout out, and invite people to come in.
Yeah. And so, during that journey, I also, because I wanted to learn more about coaching, so that's when I also signed up for life coaching certification, and just to take a deeper dive into what I learned from, being coached myself.
Yeah.
And it's just, I think this throughout this process, I just did not think that my life could be better in terms of work. And even though my workload is the same now, I have time to go home and spend time with my family, and I have time to actually even think about helping other physicians in with
Yeah.
coaching, by coaching others, as you mentioned, my one-on-one coaching program. So I just feel more um, energized. I feel I really have a full sense of gratitude that I was able to experience that and have the opportunity to share with other physicians.
And it's such a great in-depth, like you go through it, you invest in yourself and say, hey, I just need something to change. I don't know what. Like it sounds like, I'm not sure what this coaching program is going to offer me, but I'm just going to go all in. And as you go all in, and it's like, oh, it gives so much back to you. It's say, I need to give this back to others, which has been flavored in everything you said, right? Like, you joined medicine because you really wanted to help be there for people. And then it sounds like the construct of medicine, like is public, right? It's often not fit for healing. And
Mhm.
so in order to do what's most valuable to you, something needed to change. You find coaching and you get the opportunity to pay it back while also helping yourself to stay grounded in your own values and keep those coaching tools in order to find ways in our current situation to change whatever we need to change with what we can in order to improve our own time for our values. And I hear sometimes when people they think about coaching and what's the way that we talk about burnout right now, and it's kind of that dichotomy of yes, and the system needs to change because it's challenging. Can you mentioned you're staying, you have the same job,
Mhm.
but your days look so different. So for people who are in that mindset, and sometimes it is, I learned coaching, I got time back, and I changed my job. But for you, it's I learned coaching, I got time back in the same job. Can you share more about what tools you're using in order to make that happen?
I think just a step back before that is, I think for physicians in particular, before thinking about changing your job, really think about, are you thinking that by changing the job, life will be better? Are you relying on that job to give you a better life? I mean, yes, like a different environment, different situation may give you, may make you think different things, but I think also just realize that, hey, within your current situation, is there another perspective, another way to look at your job? And is there another way to do things? And I guess for me is I did not think that there was a way out other than just quit my job and do something else. But then coaching really showed me that, hey, it is possible to, to stay in my job right now and just be, you know, utilizing the positive fuels that I have, with the focus, the determination, the gratitude I have, and work, a lot more efficiently and appreciate things more. And with that, mindset that I'm able to just get things done quicker and nicer. And even my nurse practitioner noticed that in the past year or so, that was like, yeah, you're different, you're more positive and and I'm so glad that she was able to see that, because I think that was that has been how I feel, that it's just, yes, it is still a hard job, but at the same time as I'm focusing on helping my patients, and I'm also focusing on that I have the opportunity to help other physicians.
This is such valuable insight right here because for me, my story is I had suicidal ideation, and I feel sometimes when people are in that state of burnout and they feel trapped, they have no choice. I think stepping out of the environment and resting and doing something that empowers you. I think so. I did therapy and whatnot, which was helpful. I know the
Mhm,
model is kind of like CBT, but for some reason, I was hyper focusing on the diagnosis and what was wrong, where coaching helped me to focus on empowerment. And it could have been stage of life and where I was at. But what you just said was so key because I transferred specialties. I brought the same lack of self confidence. I brought the same things. The only thing that was different for me was that sleep deprivation was a really big problem for me. And so I changed the specialty to reduce the risk that I would be in a prolonged sleeplessness. I went from surgery to a non surgical
mhm,
specialty. But we often hear if people are looking to make kind of a lateral move, that they think the next job will be better. but we'd say
Mhm.
optimize where you're currently at. So know that if you do choose to leave, that the things that are within yourself that could value from being modified or being valued in a circumstance that may not be ideal
Mhm.
versus bring the non-ideal inside thoughts and feelings to the next job, which is something I did. So I'm definitely giving you the big that was really great insight from learned experience because I didn't stop to heal or to
Mm.
process and to say what needs to change within me, what thoughts, what behaviors, what beliefs need to change within me in order to be successful. And I also think, when in medicine, if you're in that situation, you have like that learned helplessness, and there's a lot of healing that needs to happen. So I
Mhm.
just wanted to keep reiterating exactly what you said and highlight it. And so, for when it comes to you as a coach, can you tell us what's kind of your prime topic to or focus?
Yeah, so I'm focusing on taking care of fellow physicians, and so general life coaching, really tailored to whatever the individual needs. So the most common things are really burnout, charting. That's, I think, the charting is bane of our most of our existence, really. So just focus on that, and sometimes there are also family dynamics. So it's kind of, I think, um, how we do one thing, it's how we do a lot of other things. So just by learning the concept of coaching, like you mentioned, for me is I'm affecting my patients, my colleagues, my family in a definitely more positive way, and so I just want to use that to share with my fellow physicians that, hey, this is really possible, because I never thought that I could go home 2 hours earlier, and I remember the first time that I did it, like I was like, what am I doing now? I actually have time to think about what to do. And so I think the the main focus is really, I want you know um, our fellow physicians to feel better, and to realize that there are a lot of things that they can control. And even though you're in an environment that seems to be, the medical system is kind of like constraining us with the insurance, with the administration, things like that, but there are things within us that we can control, and that can really translate to how how you feel about things, and then to, take the action that you need to take, because one of the most important things is to really always remember why you're doing something, instead of just keep doing and doing and doing, and not pause and think that, hey, I'm doing this because I want to help people, or I want to go home on time because I want to spend time with my family to teach my kids, things like that.
This is fabulous. And that why, I heard it in your medicine and how you kind of grind through like with the vision of the why to help and serve people. And with the vision of when you sign up for that life coaching, because people will often say, should what program should I do? And the first question is always, tell me why you want to do the program, because sometimes if people feel desperate, they want to do anything to escape. To say, I think coaching actually it might actually be maybe not intentional that it helps them heal so much, but if their
Mhm.
idea is like, I just need to do something outside of medicine, I'm like, well, let's take us back, because there's no guarantee that coaching can give you the income or whatever. But if you go in and say, I'm doing coaching one because it's going to help me, which I think it does, whoever's going through the program, it really helps them. And you're wise. I want other people to have the benefits that I have experienced through coaching. So I just love how much that is
Mhm.
exuded in your story and your enthusiasm and in your writing, which I certainly want to advocate for people to read your writing. It is so, it just takes you in. because you're a storyteller and it's fantastic.
Thank you. And I think, just a little bit about my little blog post is really, I think I just write from my heart, just, whatever I feel like, and they're true experiences. I mean, except for the patients, I change their names, but
Yeah,
pretty much, and maybe the diagnosis, I change it a little bit so no one knows who they are. But other than that, they're all real. And I think, that's also a therapeutic thing for me to do, to just thinking that I'm able to share this with other people and just write it out. And also when I'm writing, it's kind of a ref, that I get to reflect on my life, myself, that hey, this is who I am, and by writing, it's I it's another opportunity for me to be true to myself.
it's beautiful. And it certainly stands out. And I just love it so much. And I wanted to know, is there
Thank
anything,
you.
yeah,
Yeah.
absolutely. Is there anything I haven't asked you that you'd like to discuss with the audience?
I think it's very important to have gratitude. And hence my company's name is Shining with Gratitude
Yes.
MD.
Beautiful.
And I came up with that name is because I just feel like someone with gratitude, you always feel like you have things. You're not necessarily lacking anything, and you just have that abundance. And with that feeling, you're just happier in general. And when you're happier, you just do things in a more positive way, and that fuel that you use is just more sustainable than kind of the negative, like the willpower that won't last that long, the frustration that kind of like just burns you out emotionally. So I think gratitude, in all circumstances is very important. So one of the practices I think that I would like to share with people is to find something to be thankful for, even though it's a very bad situation. Kind of like the pandemic. No one wants to have the pandemic, but for me, I'm thankful because with the pandemic, I was able to really reflect on my life. In the beginning, I was only seeing a third of the patient load. So I got a taste of having time with my family and really reflect on all those things, and then got to know about coaching and so on and so forth. So so I think being thankful is very important. The second thing is I think it's important is about self-care.
Mhm.
um, you know, we always think, we're trained to take care of our patients. We're trained to think of others first before ourselves. But by doing that, sometimes it's we ignore ourselves. We don't like, I would go on a whole clinic day and not go to the bathroom until 3 o'clock. I have done that a few times.
Yep.
That's not good.
Mhm.
So, just basic things about taking care of ourselves. So, we have to be able to, take care of ourselves in order to better take care of other people. It's kind of like, we can't give someone else the love, the compassion if we don't have it for ourselves. So I think that's a very, important thing. And of course, our mental health, it's our health, it's part of our health. So just realize that, hey, if you need help, it's okay to get help. And we have that new hotline. It's at what, 988.
Yep.
Yeah. So really, get the help that we need. I think we have been doing better and better just to normalize talking about mental health. And I think that's very important, especially for women physicians, because our suicidal rate is so high. Even compared to male physicians, and of course compared to the rest of the population, is much higher too. Um, the last thing I want to uh, highlight is again, it's who you are. Kind of like when people ask, oh, who are you?
Mhm.
A lot of times we hear that, oh, I'm a doctor, I'm a mom, yes, all those things are true, but who are you actually being? Like for me is, I am the person who wants to help other people. I am a person who is thankful all the time. And I'm the person who wants to serve others, who want them to feel better and have more control of their lives, and just, and with that ripple effect to make the world a better place.
I like want to cry through all of these messages. Uh, Very dear to my heart. I think those are all extraordinary messages. And people that know my story know that suicidal ideation was a very strong part in this channel. Is everything that you are everything, right? Like if I had to pick, they have the ACE. It's like hard to see on Zoom. Which I have ACE here. It's all about authenticity, courage, empowerment. It's where we actually met in real life, and that the
Yeah.
success you are ACE, and I can certainly link your
And
also.
you are too.
Oh, and shout out to Green Cloud Apparel for both of us wearing their scrubs. And
Yay.
also, it makes me certainly want to link. You wrote about mental health in Kevin MD, and to share your website. Can you please tell, especially if people are just listening, share with them where your website is, and of course, we'll also link it down below.
Yeah, so my website is www.shiningwithgratitudemd.com.
This has been such a great discussion. Thank you so much for joining me today.
Thank you so much for having me.
And everyone, as you can obviously see, if you're interested in coaching or some great reads, if you need some support healing, please get in contact with Dr. Leung. Make sure to stay tuned for more. I would love to have more conversations with you. I was stumbling across some of my questions because, like, I want to ask you about a million things at one time, but really appreciate your energy, your messages when you exude the gratitude and everything that you said. It certainly shines through in your presence.
Thank you.
Yes. And thank the audience. Thank you so much for joining us today. Make sure you subscribe. And until next time.
Bye.